What is relationship between AstraZeneca vaccine and blood clots? Is there any scientific evidence? As of this video's publication date of March 15, 2021, there is no known evidence that connects AstraZeneca vaccine and blood clots. On March 3, 2021, Austria suspended the use of a batch of the vaccine after 2 persons suffered blood clot-related complications after vaccination that resulted in 1 death. In total, 4 blood clot cases have been identified for the same batch of 1 million doses. Although no causal link with vaccination had yet been established, several other countries, including Denmark, Norway, Iceland, Romania, Bulgaria, Ireland, Italy, Spain, and Germany also halted the vaccine rollout while awaiting for the European Medicines Agency to finish a safety review. Vaccines are reactogenic, which means when they work people could feel ill. As per doctors, COVID vaccine side effects are normal, and certain effects are coincidental, can happen even without vaccine. You may feel flu-like symptoms like headache or body aches. It is absolutely normal. Let's learn more. What is a blood clot? A thrombus, colloquially called a blood clot, is the final product of the blood coagulation step in hemostasis. There are 2 components to a thrombus: aggregated platelets and red blood cells that form a plug, and a mesh of cross-linked fibrin protein. The substance making up a thrombus is sometimes called cruer. A thrombus is a healthy response to injury intended to prevent bleeding, but can be harmful in thrombosis, when clots obstruct blood flow through healthy blood vessels. What is AstraZeneca vaccine? The Oxford AstraZeneca COVID-19 vaccine, codenamed AZD1222, is a COVID-19 vaccine developed by Oxford University and AstraZeneca, given by intramuscular injection, using as a vector the modified chimpanzee adenovirus ChAdOx1. One dosing regimen showed 90% efficacy when a half dose was followed by a full dose after at least 1 month, based on mixed trials with no participants over 55 years old. Another dosing regimen showed 62% efficacy when given as 2 full doses separated by at least 1 month. The European Medicines Agency stated that there was no indication that vaccination had caused blood clots, which are not listed as side effects with the vaccine. According to the EMA, the number of thromboembolic events in vaccinated people is no higher than that seen in the general population. As of March 11, 2021, 30 cases of thromboembolic events had been reported among the almost 5 million people vaccinated with the AstraZeneca vaccine in the European Economic Area. On March 14, 2021, AstraZeneca has confirmed that after over 17 million people have been vaccinated in the European Union and UK, there has been no evidence of an increased risk of blood clots in any particular country. The company reported that as of March 8, 2021, across the EU and UK, there have been 15 events of deep vein thrombosis and 22 events of pulmonary embolism reported among those given the vaccine, which is much lower than would be expected to occur naturally in a general population of that size. Hashtags AstraZeneca vaccine, blood clots, evidence. What is relationship between AstraZeneca vaccine and blood clots? Is there any scientific evidence?